my name is Julie Balcostudio, your nurse student from Davao Doctors College. So I am here today to perform my written demonstration of assessing the 12 cranial nerves. So let's get started. So pre-introductory phase. Number 1. Review the patient medical record if available. It is time for you to know the previous medical history of the patient and provide focuses on the physical assessment of the patient. This is done in order you to be able to know the extent of your physical assessment, and also the preparing equipment is you will be able to save energy and time. Next is perform hand washing and wear gloves if necessary. This is done to prevent the spread of microorganisms. Introductory phase. Number 4. Greet the client politely and introduce yourself to the client, and ask the client's name using the 2 identifier, which is you can ask the name of the client, the birthday of the client, and you will compare it to the band or bracelet or wristband of the client. And also ask the client on how he or she would be called during the assessment. And also establish rapport to the client. This is done in order for you to verify if you have the correct client. And also establish rapport with the patient. So, good day ma'am. I am Julie Balcostudio, your nurse student for today. So, I am here today ma'am to perform my written demonstration or to assess your cranial nerve, ma'am. So, what is your name, ma'am?
Grace Tura,
When is your birthday po?
August 22,000.
How would you like to call you, ma'am, during our assessment po?
Lenny.
Okay, ma'am. Pwede ko magtanong sa wristband, ma'am. Okay, ma'am. So, before tayo mag-start, ma'am, is atong buhaton karon na assessment, ma'am, is yun na nga, cranial nerves. Assessing yung cranial nerve. So, na yung mga position may pabuhat sa imuha, ma'am, or na yung mga ipasimhot, ipatilaw sa imuha, ma'am. So, okay lang ba sa imuha, ma'am, ang temperature na to? Okay, ma'am. So, assessment of cranial nerves. Number 7. Cranial nerve number 1 are olfactory. Ask the client to clear the e-nose to remove any mucus, then close eyes, include one nostril, and identify the scented object that you are holding, such as coffee powder or bar of soap. Let patient describe the smell. So first is for the cranial nerve number 1 or for the optic nerve. So first I will tell the client to close her eyes. So ma'am, can you please close your eyes, and can you please ganito po yung nostril mo, ma'am? So, I will going to smell this alcohol, this object to her. Ma'am, saan mong nasimhutan, ma'am?
Alcohol.
How about for sa other side ng nostril, ma'am? Ano saan nasimutan, ma'am?
Powder.
Okay, ma'am. So, it is normal. Number 8. Cranial nerve number 2 or optic nerve. To check for the visual acuity, use an eye-held hand card and ask the patient to cover one eye and read aloud the print. Number 9. Cranial nerve number 2, optic nerve. To check for the visual field, face the patient directly and ask the patient to look into your eyes, then place your hand 2 feet apart lateral to the patient's ears. Slowly move the finger until the patient identifies them. Repeat the upper and lower quadrants. Cranial nerve number 3, 4, and 5 are oculomotor, trochlear, and abducens. Check the upper eyelids while the patient is looking directly at you. The eyelids should not obscure the vision. Next, inspect the pupils. They should be round and equal in size. Then check the pupillary reaction by shining the light in the pupil and observe for the direct and consensual reaction. Next, hold your finger about 10 cm from the patient's eyes and observe for pupillation while asking the patient to focus in your finger and afar. Lastly, check for extraocular movement in the 6 cardinal direction of gaze. Then stand to 2 to 3 feet in front of the patient and ask the patient to follow your finger as you make wide edge in the air. Number 11. Cranial nerve number 5 or trigeminal. The mandibular, maxillary, and ophthalmic division should be tested symmetrically for pain, light touch, and temperature. For pain, use Q-tips sharp and dull ends. Ask the patient to close eyes and stimulate the forehead and cheeks at the point indicates. Use both hands of Q-tips as you test along scattered areas. Compare symmetrical areas on both sides of the face. Number 12 for the also for trigeminal. To test the light touch using the wisp of cotton, test in the scattered areas and compare sides. Number 13. Also for cranial nerve number 5 or trigeminal, to check the corneal reflex, ask the patient to look up and away from you. Approach the patient from the side out of his line of vision and lightly touch the cornea with a white wisp of cotton. So next is for the cranial number 2 and 3, which is the optic nerve, and for oculomotor nerve, which is to assess the visual field. So I will going to instruct the patient to look where I instruct her to look by. So ma'am, can you please look at the left upper horizontal, left lower horizontal, about the right upper horizontal, right lower horizontal. Thank you, ma'am. So next is for the cranial nerve number 5 and 6, which is the trochlear nerve and the abducens nerve. It is to assess for the extraocular. So, I tell the patient to please in a supine position. Ma'am, can you please do a supine position? Number 14. Cranial nerve number 7 or facial nerve. Stand in front of the patient and ask to smile, frown, show teeth, puff cheeks out, purse lips, raise eyebrows, and close eyes tightly against resistance. Normally, the patient could do these maneuvers easily. So next is, I will ask the client to close her eyes and I will force it to open. Ma'am, can you please close your eyes? Open na, ma'am. Then, can you please show your teeth? Smile and pop out while palpating the strength of muscle. Number 15. Cranial nerve number 8 for acoustic or vestibulocochlear nerve. To assess for hearing, test one ear at a time and occlude one of the patient's ears with your fingers. Stand 1 to 2 feet away from the patient and conceal your mouth to prevent lip reading, and test open ear first by whispering number or words that contain equally accented syllables, such as 99 or baseball. Ask the client to repeat what you have whispered and repeat to the other side. Number 16, for also the acoustic or vestibulocochlear nerve. To assess the lateralization, to perform Weber's test, use a tuning fork and place at the base of vibrating tuning fork at the top of the patient head. Then ask if the sound is louder in one ear or the same both ears. 17. Cranial nerve number 8, also for acoustic or vestibulocochlear nerve. Perform the rain test to compare air and bone conduction. Place the vibrating tuning fork on the mastoid process behind the ear. When the patient indicates that the sound is no longer heard, quickly place the vibrating tuning fork nearest at the ear canal. Be sure also check the opposite ear. Assess accommodation by asking the client to stare at the object for 3 to 5 feet away and move an object toward the client. Ma'am, pwede ni mo na ka ng sundan, ma'am. Number 18. Cranial nerve number 9 and 10. Glossopharyngeal and vagus nerve. Ask the patient to say "ah" and assess the patient voice. It is hoarse, thus is have nasal quality. Observe the soft palate and the uvula. The soft palate should raise promptly and symmetrically, and the uvula should remain midline. Inspect the interior and posterior pillars and the pharynx. Number 19. Cranial nerve number, also for number 9 and number 10. So for glossopharyngeal and vagus nerve. Test the gag reflex one side at the time using the tongue blade and after warning the patient. Stimulate back at the throat lightly on each side in turn. You should see a raise on the palate and other sign of gagging. Ask the patient to swallow. It should be done without difficulty and regurgitation. Next is for the cranial number 10, which is the vagus nerve. Then ask the client to widely open her mouth. Ma'am, can you please open your mouth, ma'am? Thank you, ma'am. And with the assess voice for person. Ma'am, how are you today?
I'm good.
Then ask the client to cough to examine the vagus nerve impairment. So, ma'am, can you please umubo ka? Number 20. For cranial nerve number 11. For spinal accessory. Open the patient in gown to reveal the upper trapezoid muscles. Ask the patient to shrug his shoulder upward against your hands. Evaluate the strength and contraction of the upper trapezoid muscle. After, ask the patient to turn his head each side against your hand and observe the contraction of the opposite sternocleidomastoid muscle and notice to force the muscle against your hand. Okay, so for the cranial number 11, which is the spinal accessory nerve. So I'm going to stand at the back side of the patient and ask the patient to shrug her shoulder. Ma'am, can you please shrug your shoulder? Thank you, ma'am. Next is Number 21. Cranial nerve number 12. For hypoglossal nerve. Ask the patient to open his mouth and assess for tongue atrophy and fasciculation. After, ask the patient to stick his tongue out. Note for any asymmetry or deviation from midline. The tongue should protrude straight out. Lastly, I will assess for the cranial nerve number 12, which is the hypoglossal nerve. Ask the client to open mouth and protrude down and assess for any deviation. So, ma'am, can you please open your tongue, ma'am? Sige pa po. Very good. For the test for the tongue strength, I will ask the patient to protrude tongue to side of the cheek while press it at the side of the cheek. Ma'am, can you please protrude your tongue on your cheek, ma'am? Other side, ma'am. Thank you, ma'am. So, we're done sa atong assessment, ma'am. So, balato na lang ito ang result niya ikon sa doctor. And thank you po, ma'am. Thank you po sa participation. Bye, ma'am.